Hello, everyone. Welcome to Beyond Blue, Understanding Mental Illness. My name is Jamie Hanson, and I'm thrilled to be your facilitator this afternoon. A little bit about my background. I am a professional counselor by training. I've been working in the area of mental health for over 25 years now, which is hard to believe. Throughout that time, I've specialized in such things as grief counseling, marriage counseling, depression, anxiety, mood disorders, as well as I've worked in employee assistance work. So this is being brought to you by your employee assistance program, Uprise Health. And I'm so thrilled that you've chosen to join us today. We've got a lot of really good information for you, and I'm looking forward to the time together. And we have amazing information to share. And at the same time, I want to let you know that this isn't to take the place of medical advice. We have some excellent information for you on mental health. It is truly for informational purposes, and it's not meant to be a substitute or replace any professional medical advice that you would get from your own healthcare professionals. We want to make sure that you seek the advice of that person that knows you. So your own physician or other mental health care provider, so they can help you with the proper treatment and answer any questions that you might have. And also, we don't want you to delay or disregard any professional medical advice that you've received, because once again, this is great information in this webinar. However, we can't overstate the importance of working with professionals that know you and your particular situation. Okay, on the next slide then, we have our agenda for today. And here's what we're going for. We've got a very robust agenda. After our time together, you will be able to define mental illness, discuss the prevalence of mental illness in the United States. Also, you'll be able to identify the signs and symptoms of the most common mental illnesses, and then also access various forms of support for yourself or others. So we've got a lot that we're going to be able to do, and especially at the end, share with you what you can do to access various forms of support, whether it's for you or for a loved one. Okay, so let's start right off on the next slide then with the definition of mental illness. I'm going to read through this, and I think it bears repeating, but mental illnesses are diagnosable health conditions involving changes in thinking, emotion, behavior, or a combination of these. So I'm going to read that one more time. Mental illnesses are diagnosable health conditions involving changes in thinking, emotion, behavior, or a combination of these. We also know that mental illnesses are associated with distress and or problems functioning in social, work, or family activities. And then finally, the term mental illness itself refers to the collective of mental illnesses. So in other words, there's an umbrella the diagnosis of mental illness actually has several different specific diagnoses underneath it when we're talking about mental illness. On the next slide, then, let's talk about some common misconceptions about mental illness. Oh, and by the way, our definitions and much of this information comes from the American Psychiatric Association, and they truly set the gold standard when it comes to treatment, definition, diagnosis, and then ongoing care, and just keeping our information current. So all of this information you're getting on the front end here especially comes from the American Psychiatric Association. Okay, I can tell you in my 25-year career, there are a lot of misconceptions out there about mental illness. We'll get into some of the reasons for that in a little bit. I can also tell you that before I went back to school to get a license to become a professional counselor, I actually held some of these beliefs. I had some of these misconceptions just from my own life experience. So don't feel bad if this is something that you have believed or maybe said or have been exposed to. It truly is the case that there are a lot of misconceptions out there. So don't feel bad if this is something that you have believed. That's part of the reason you're getting the very good information today. So I want to walk through all of these because they are some pretty powerful misconceptions. That first one there, it's all in someone's head. Well, if you think back on the last slide, the definition of mental illness, it's established that these are medical and diagnosable disorders. They are not fiction, and they are certainly not made up. These are truly valid medical conditions that require some form of treatment in order for stabilization or resolution of some sort to occur. So it's truly not something that's fictional or something that someone is just kind of sensing. Um, it is absolutely a validatable medical condition. The next one is related then, that they're not medical disorders. These are psychiatric disorders, and some of which, by the way, depression and anxiety included, are among the most commonly diagnosed conditions in all of medicine. Okay, so not only are they medical psychiatric disorders, but they are among some of the most commonly diagnosed in all of medicine. And you know, that strikes me when I think about all of medicine and all of the diagnoses out there. If you think about cancer, oncology, orthopedic issues, heart conditions, chronic conditions, diabetes, thyroid disorders. Of all of those potential conditions out there, depression and anxiety are some of the most commonly diagnosed. We're going to get into prevalence in a little bit, but these definitely are medical disorders. Another common misconception is that people can snap out of it. There's this kind of pull yourself up by your bootstraps, you know, rub some dirt on it. It's not as bad as you think, kind of a mentality that's very common. But I really want to stress that many mental illnesses have biologically based features that actually render them impossible to snap out of without proper medical care. And by that care, we mean some form of treatment, be it medication management or talk therapy or some combination of both of those. As we discussed on the last slide, that there is a certain amount of distress that goes along with mental illness. So believe me, if this is something that people could snap out of, they most certainly would. So it's not something that you can just outthink, no more than you can outthink a broken leg or outthink a type 1 diabetes disorder. There's not that snap out of it kind of opportunity. Another very common one is that medication doesn't work. And if you think about this, this is a pretty loaded and layered belief because it's true. In some cases, medication may not work, and we can validate that for anyone in the room who may want to believe it. However, research tells us that medication in many cases is an effective form of treatment, especially when we combine it with talk therapy. In fact, research tells us that when we combine medication with counseling or meeting with some sort of a professional, that actually is going to give the most powerful and most expedient return to normal for that individual, getting them to feel like themselves again. So that's going to give the most immediate and lasting form of symptom relief. Also, we know that if it's only going to be one or the other, medication or talk therapy, which is up to the patient to choose with their doctor's advice, we do know that medication is the most powerful and expedient form of treatment again. Now, we need to keep in mind that sometimes one may have to try different dosing or different medications in order to find the right fit, as is true of a lot of different medical conditions. So different medications treat different symptoms. So it is really important for people to communicate with their doctor in order to find the right combination. I know when I'm working with clients and they're working with their medical professional when it comes to medication treatment, one of the things that we will talk about is just like there are many different sizes of shoe and there are even widths of shoe, sometimes it takes trying on a few different sizes to make sure that we get that right fit. And so that communication with a medical professional is very important. I always encourage my clients to be polite complainers. Often I'll hear from my very kind client, oh, I don't want to bother them. I don't want to be a hassle. Believe me, you're not being a hassle. Your doctor, your medical professional wants you to have the right medication and the right fit. So it does take a little bit of back and forth. And a call to the doctor's office can help you find out, okay, is this a side effect that might go away in a week or two, or is this a side effect that really shouldn't be experiencing, or it's causing more distress than my medical professional would like to see? And so that communication is paramount. So medication does in fact work, and it works even better when we're in communication in lockstep with our medical professional. So there's another misconception out there that mentally ill people are violent. And I do believe that this is often fed by movies, television sometimes, and that mentally ill people are violent. We do know that people living with mental illness are not inherently violent. That's not true. Now, irritability is a common feature of many mental illnesses. However, irritability alone does not ensure that someone's going to be violent. Irritability is the feeling and violence is the behavior. So irritability, that's not a one-to-one relationship with every mental illness, that irritability is going to be a feature of that mental illness, nor is it for everyone. And then also, even if irritability is present, I want to be clear that that alone does not ensure that someone is going to be violent. And then finally, a common belief is that it can't happen to me. What we do know is that even people without a family history of mental illness can experience one in their lifetimes. There certainly are various risk factors that set us up for mental illness, and the more of those that we experience, the higher the likelihood that we will develop a mental illness ourselves in our lifetime. So it's definitely something that can happen to us. Okay, so now that we've put a few of those misconceptions to bed, let's go on to the next slide and talk about the prevalence and impact of mental illness. I'm going to walk through each of these statistics that come to us from the National Alliance on Mental Illness, a great resource for information both on treatment options, information on different conditions, and also statistics as far as how this is impacting us as a society. We do know that 1 in 5 adults in the United States, approximately almost 44 million people, will experience a form of mental illness each year. So that's about 20%. 1 in 5 adults in the United States will experience a form of mental illness each year. We also know that 1 in 25 adults, now we're talking about 4% or approximately 10 million people, will experience a serious mental illness each year that severely interferes with daily life activities. Now, by daily life activities, we're talking about things like going to work, caring for family members, daily hygiene, taking care of the home or the residence. So we do know that 1 in 25 every year, about 10 million people will experience a serious mental illness. And then mood disorders, things like depression, anxiety, bipolar disorder, are the third most common cause of hospitalization in the United States for people ages 18 to 44. And once again, back to what we were talking about earlier, if you think about it, of all of the reasons people could be hospitalized between the ages of 18 and 44, different medical conditions, accidents, broken bones, these are the third most common cause of hospitalization. And it's true, hospitalization can help with resolution and getting a solution for the condition. So that's an impressive number to me, that they are the third most common cause of hospitalization. And then finally, 1 in 8 of all emergency room visits in the United States, 1 in 8 is related to mental health and substance use disorders. Okay, so that's also a very high number. We're talking about 12% of all emergency rooms, or excuse me, all emergency room visits are related to either mental health or a substance use disorder. Okay, let's go on to the next slide where we've got some more data for you. We know that depression and anxiety cost the global economy $1 trillion each year in lost productivity. And also, depression is the leading cause of disability worldwide. Truly is a long-term disability cause for that, and so it's the leading cause of disability worldwide. We also know that there are a number of medical conditions along with depression that will combine. We call that comorbidity, and those two conditions will feed off of each other. So not surprising to see that. We also know that 19% of adults in the United States with mental illness also have a substance use disorder, and that 46% of people who die by suicide have a diagnosed mental health condition. Okay, so there's a lot of information there on the prevalence of mental illness and the impact that it has not only on our United States economy, but on the global economy as well. Okay, let's go on then to the next slide where we're looking at what all are we talking about when we're talking about mental illness. You see from that infographic there on the right-hand side, there are a lot of diagnoses of specific mental illnesses that fall under the collective, the umbrella, if you will, of mental illness. So we're talking about a number of ones. I'm going to hit kind of the highlights with a few over here on the left-hand side. These are some of the most common. So we're talking about depression. And by the way, there are actually a number of different forms of depression that have been identified. And so it's important to know that it doesn't always look the same. So for example, not everyone isolates socially or will lie in bed, sleep a lot more. And so that's one of the reasons it can go undetected. People can actually function pretty well when they have a different form of depression. So that doesn't always look the same depending upon the kind of depression and also the person involved. Also, anxiety. It's important to know that there are healthy levels of anxiety. For example, being nervous about passing the exam or being anxious before walking down the aisle at your wedding, etc. However, clinical anxiety is marked by excessive fear and worry that interferes with daily functioning. And these fears can be very real or they can be irrational. But generalized anxiety disorder is when it's excessive fear and worry that is starting to interfere with our daily functioning. Also, bipolar disorder, this is often called by another name, manic depressive disorder, but bipolar disorder is really the professional name for it. This is characterized by mood instability that can fluctuate between severe depression and manic episodes. If you're unfamiliar, a manic episode is where the person is engaging in impulsive behaviors, possibly addiction. They might not be sleeping. They're operating at a very fast pace oftentimes. Moving along very, very quickly. But also, it's very important to note that there are different levels and also intensities of bipolar disorder as well. One example we have is that Mariah Carey recently disclosed that she was diagnosed with bipolar 2 disorder in 2001. Bipolar 2 disorder is a less intense but still serious form of bipolar disorder. And so that's, again, where we go from having a depressive episode, and then there's a manic episode that follows that, followed by a depressive episode. So the bipolar 2 is less severe, but it's also still very serious. Post-traumatic stress disorder is our next one, or PTSD, as perhaps you've heard of it. This is a common form of mental illness that gets more complicated the longer one goes without treatment. We do know that it's the result of experience a traumatizing or triggering event that the person interprets as dangerous or traumatic, and the emphasis is on their interpretation. Okay, so this is why some people might get PTSD from car accidents and others don't. It's really about the perception, what was I thinking, what was I feeling in that moment, that makes a significant difference. Schizophrenia is a disorder where there is a detachment from reality, and hallucinations can be experienced through the 5 senses. The most common hallucinations are auditory, which might involve hearing voices, although many people experience tactile hallucinations, for example, feeling bugs crawling on them or biting them, and olfactory hallucinations, which means smelling scents that aren't really there. A key distinction between a hallucination and a delusion is that people literally experience hallucinations through one or more of the senses as if they are really happening. And a delusion is a strong belief in something that can be proven untrue. For example, that the CIA is following me. Hallucinations to the person experiencing them feel real. For them, it's like it's actually happening. So that's an important distinction to know. Obsessive compulsive disorder, also known as OCD, is a form of an anxiety disorder, and the compulsive behavior is actually perceived as a coping mechanism for the person who suffers with this. The compulsions bring order, peace, or relief when the person experiences extreme anxiety about something. So the obsessive piece is something I'm thinking about, and then the compulsion actually comes in as a way to alleviate that stress. The key here again is when that starts interfering with daily life activities. And then finally, ADD or ADHD is marked by unusually hyperactive behavior and an inability to concentrate that becomes disruptive and debilitating. It's most commonly diagnosed in children and adolescents, but it is also diagnosed in adults. Okay, so there's a very high level overview of some of the most common forms of mental illness. And it's important to keep in mind that these all have different looks about them, but those are some of the most common signs and symptoms for those. Let's go on and talk about the signs of mental illness on the next slide. Now, I want to clarify that this is a list of common signs. but that doesn't mean that it's a list of symptoms of all mental illnesses. So we want to be really clear that these are things that people might experience, but they may not experience all of them, or someone experiencing a different mental illness might not experience any, but these are some of the common signs and symptoms. So they might be something that we would observe in others or in ourselves, and especially when we see more than one, we might want to consider, okay, would it be good to get more information from a medical professional? Would we want to get more information from someone like my own physician, my family doctor, or perhaps a mental health professional? So here's what they are. Social withdrawal, where perhaps if I'm a very outgoing person and now all of a sudden I don't want to do that, I don't want to be spending time with others, can be one sign of that. Also shifts in mood, where it seems like the mood swings from being depressed to hyperactivity or irritability. Dramatic changes in sleeping habits. And the next one's like it, dramatic changes in eating habits. I'll take these two together because they're both related. The key word here is not necessarily for sleeping more or sleeping less, or eating more, eating less. The key word here is if there's a change. So if I'm normally someone who gets about 8 hours of sleep and now all of a sudden I'm dealing with insomnia, either I'm having a hard time falling asleep or staying asleep, and that's not typical for me, then that's noteworthy. And the same thing goes with eating, whether it's more or less. If I'm all of a sudden eating a lot more, perhaps I'm maybe craving carbs to give me energy, doing some emotional eating, or maybe I have no appetite whatsoever, even though I haven't eaten anything all day. If that's not typical, which is not for most of us, but if that's not typical, then that's something we definitely want to pay attention to. Certainly, anytime there are feelings or talk of worthlessness or helplessness or hopelessness, those can be a sign of depression, and so we do want to pay attention to those. And a loss of concentration is one of the most common ones that I see in the clients that I work with. I absolutely will have clients walk in and they've got a great memory for numbers or names or dates, and why did I walk into this room? I forgot why I even walked in here. This is a very common one. So short-term memory loss and a loss of concentration is commonly associated with stress, and also depression, anxiety, mental illness. So the good news is that this is not permanent. Once we get some relief for our symptoms, whether that's through talk therapy or medication treatment or some combination, we do know that that is one of the symptoms that can be alleviated. So that's often very good news for my clients. So that one will come back. And certainly thoughts or threats of suicide are something we always want to take seriously. If we're having thoughts, again, this is a symptom of depression, or if there are any threats involved, we certainly want to make sure that we're taking great care to get the authorities involved right away. I always recommend to people, this is hard advice to give to family members and friends, but we would much rather call 911 or take that person to our next emergency room at the risk of upsetting them than losing them altogether. So whenever you're hearing of thoughts or threats of suicide, we want to make sure that we're taking that very, very seriously. And then also substance abuse. This can cause symptoms of mental illness, but also we can often see an increase in substance abuse when someone's dealing with mental illness as a way of coping with some of the symptoms. And certainly not recommended, but that's not uncommon to see an increase in use of substances to deal with the symptoms that someone is experiencing. So here are some signs. Again, these are some general signs, but important to know that you won't see all of these in a mental illness, and you might see a different combination depending upon the person, their environment, and what's going on with them specifically. Okay, let's go on to the next slide, please, and talk about some facts about mental health problems. Let's see. Oh, I almost skipped that one. There we go. Okay, so some mental health issues that we commonly see in the workplace. These are some of the most common ones, and these come up, and we'll cover these in the next few slides. Things like anxiety, depression, alcohol abuse, tobacco use, marijuana, prescription drug abuse, problem gambling, and eating disorders. So those are some of the most common ones that will reveal themselves in the workplace. Okay. Now let's go on to the next slide with some common facts about mental health problems. These are true. I found every one of these to be true, not only in general from a statistical point of view, but also just one-to-one, colloquially speaking, in my mental health practice. It is true that most people feel very uncomfortable talking about mental health, and this does contribute to the stigma. One firm that I've consulted with, actually, where I go on site and have been their employee assistance professional, it's an office that is also shared with that particular organization's physical therapist. So we're both contractors, we both go in. And it's very funny because everybody is comfortable coming to talk to the physical therapist, but they're not as comfortable letting people know that they stopped by to see the therapist, the mental health therapist. So very interesting. We just have a disconnect there when it comes to talking about mental health. Maybe that's why those statistics earlier may have surprised you, that 1 in 5 people will deal with a mental illness in a given year. That's 20% of us. That's a lot of people. It's just not something that we're talking about publicly or over the water cooler. And this does in fact contribute to the stigma. We do know that people with mental illness can be stereotyped and discriminated against. I do believe because it's just misunderstood so much. And certainly by ridiculing someone, we create a barrier that makes us think we're not like that person. Certainly we want to believe that it has something to do with them or something that they're doing, perhaps doing wrong. So therefore that could never be me. Like psychologically speaking, if it's something that they've done or something that sticks to them, then psychologically I might feel a little bit safer, but we just know that that's not true, that we all have some level of exposure to the possibility of dealing with mental illness. And honestly, for some people, the impact of stigma truly is worse than the symptoms of their illness that they're experiencing. And unfortunately, that one, if that causes someone to not seek treatment, we do know that these things can progress and that can actually make their symptoms worse over time. And also we're frightened by mental illness in a way that we're not from physical illness. And, part of this can be because it's just harder to measure. I can see a broken leg, I can see a broken arm, I can blood test for certain things. We know, okay, here's this number, here's where it should be. And it doesn't defy logic when it's a physical condition. But sometimes with the mental illness, we don't understand it. And again, some of these misconceptions certainly spin that up. Okay, more facts on the next slide about mental health problems that we see. The stigma will make people reluctant to admit that they're struggling, and this can delay treatment and support. That's not uncommon whatsoever. And we are aware of how people's recovery can be held back by the barriers that the stigma creates, often through problems encountered at work. And so to reduce stigma and discrimination, we need much better education like this, which is one of the reasons I applaud you for spending an hour of your day to get this really good information. And teaching people the facts about mental health problems and getting rid of the myths is one of the most important things that we can do. And I want to stress again, I can't say this too much. Maybe you've held some of those myths or misconceptions, but now you're getting the right information. And so we definitely want to be screaming this good information from the rooftops. If I can say one good thing that I do believe has come from this pandemic, this crisis, is the fact that it's made it more okay to say, I'm not okay. Right? You hear that now. It's okay to say, I'm not okay. Now, all of a sudden, all of us were dealing with a major crisis and a stressor, and it became more obvious that people weren't going to be feeling okay. So I do think that has freed that up, and I can't even tell you how many requests we get for this kind of information to get out there. So this has definitely opened doors to share the right information about mental health rather than letting all of those misconceptions just sit out there and continue to fester. Okay, so some more facts then on the next slide. It really is true mental health has nothing to do with intelligence. It is true that it can happen to anyone. Mental health issues can be chronic, but they are not contagious. And they can also be difficult to diagnose and to treat. It can take a little bit of time to really get specifically what is going on and get the right relief for that person from their symptoms. It can be treated, but not cured, depending upon the kind of issue that's going on. So if I have a situational depression, that would be something that's brought on by, say, a death in the family, a loss of job, a major life stressor. Certainly we can get life back to normal, so to speak. And by the way, one of my dear friends who's an occupational health nurse says normal is a setting on the dryer. So normal has different looks for all of us, right? So it definitely can be treated, and that's important to know. And then also it's important to know that mentally people are not all dangerous, or excuse me, mentally ill people are not all dangerous, as we discussed earlier. And it should never be confused with the terms psychopath or sociopath. Those are very specific and also much less common diagnoses. Okay, so let's go on to the next slide, factors that can contribute to mental health problems. Certainly having a family member that has had mental health problems can increase our risk. There are hereditary components to that. Imbalances of chemicals in the brain may lead to mental health problems. We know that based on those colored pictures of the brain, those PET scans that can show us that. Also, positive or negative events can trigger problems. Example, like the death of a loved one or promotion can cause that. And also, we do know that major illnesses such as a heart attack, stroke, or cancer can also trigger mental health issues. So that can trigger depression or anxiety issues. Furthermore, certain medications used alone or in combination can cause side effects much like the symptoms of mental health problems. So that can also be a side effect of a medication. And then use of alcohol or other drugs can lead to or make symptoms worse. And we also know that mental health issues can also occur for no apparent reason. For whatever reason, our body can be hit with this, and it can show up just like certain physical things can show up for no apparent reason. So we certainly all are, we do have the possibility of being exposed to mental health issues. Okay, let's go on to the next slide and talk about what we can do for ourselves. And it's important to acknowledge that you're not feeling your best without any guilt or shame. We've all been through a lot. Perhaps you've been through a lot. It's not that you haven't been taking good care of yourself or you haven't been doing enough. It's just important to start by acknowledging, you know what, you just haven't been feeling your best, and that's okay. Sometimes we might have some beliefs that kind of block us from seeking the help that we need or admitting that we're not feeling the best. And really, the sooner we just acknowledge, gosh, I just don't feel like my normal old self, the sooner we can get some sort of help going. Also, a great idea to seek the support of a partner, family member, or friend. So oftentimes I will have someone come into my office for the first time and they will bring that supportive person with them. It's just kind of nice to have that, especially if that's your first time ever meeting with, either talking to your doctor about these kinds of concerns, maybe it's your first time dealing with this. So don't be afraid to ask a family member or friend to support you. They'll be honored to do that. And acknowledge that you may need professional support. Just like you do what you do all day long and you're an expert at that. I'm a professional counselor, but there comes a point when I've got to call the electrician. Like, I can't take care of that by myself, or I need to call the plumber, or I need to call in the expert in IT. Just like we have experts in all those fields and what you do, we have experts in mental health. So don't be afraid to get the experts involved. We want to help you. See your doctor, ask for a referral if necessary. And also, it's okay to avoid stressful situations to the best of your ability. If you know going to that event or doing that particular thing, or engaging that particular workout today is just going to add to your sense of stress or depression or anxiety, it's okay to take a break. So know that that's all right to do that. We're not doing it forever. We're not necessarily taking a break forever. But if that's going to help get you some rest or the reset or the peace of mind that you need, then by all means, go for it. It's good to take care of yourself that way. Okay, let's go on and talk about what do we do when we're dealing with others. A few things you don't want to say, and again, no shame, no harm if you've said these things. All of these can be attributed to things that are often said with the best of intentions. We don't want to see somebody in pain. We don't want to, have them hurting. We really want to help them out. But these we know are not helpful. So I know how you feel. Even if you've been through a similar thing, you don't know what it's like for that person in their shoes. It's not as bad as you think, and it's all in your head. Those kind of relate to that, snap out of it kind of mentality. You have a lot to be grateful for. Focus on that. Now, this one comes up. It's kind of sneaky because we do know that gratitude can go a long ways when it comes to helping us maintain our mental health. But I saw a marquee one time in my community that said, "We are too blessed to be depressed." I love that. It's true. We may have a ton of things to be thankful for, but we're not too blessed to get any particular medical condition like a cold or, cancer, heart disease. So also we do know that mental health disorders are medical conditions. So gratitude is not enough to say, well, I'm not going to be able to get that, so I should just focus on that. Excuse me. Everyone goes through something. You'll be fine. Just rub some dirt on it. Just push through it. Believe me, if someone is telling you that they're experiencing those things, that they're experiencing these things, they've tried a lot of these things and thought a lot of these things themselves already. Okay, quick sip, and let's go on to the next slide. What are some things that we can do for others? We can listen. And the great news here is you don't have to have pretty words of advice. You don't have to have any words of advice, especially if you're not a professional. The best thing you can do with them is sit with them, let you know that you acknowledge that maybe they're not their normal old self, they're not feeling their best. Let them know that you love them, you care for them, you believe in them, you're going to be there with them. One of the things that I hear time and time again from my clients that is the most helpful thing is, I love that he or she said to me that they don't have all the answers, but they are just going to be here for me. Isn't that great? You don't have to have all the answers, just be there for them. If they ask, you can definitely provide referrals. Do you have a counselor or someone, a mental health professional you know? You can give them the employee assistance program information, but definitely, you can provide referrals, but wait until they're asked. Otherwise, it might sound like you're trying to silence them or you just want to give them a quick fix, but definitely something you can do. And like we mentioned earlier, if you're ever concerned about immediate harm to themselves or to another person, please call 911 immediately or go to the nearest emergency room if that's something that they will do with you. That requires immediate treatment and intervention. And take yourself out of that position where you have to do that threat assessment. Unless you're professionally trained, no, let's leave that to the authorities. And even if you are professionally trained, if it's a family member or friend, there's no objectivity. So we always want to call 911 or go to a nearest emergency room if we're concerned about physical harm. And also be clear on your boundaries. Sometimes if you're doing such a great job of listening and befriending, that person might actually use that and delay treatment or delay getting the help that they need. And you'll know it. If you feel like, gosh, I've kind of hit my ceiling here on what I'm able to do, you can say things like, you know what, I'm here to be your friend. I'm here as your wife, your spouse, your family member. I'm here to support you no matter what. But I also want to make sure that you're getting all of the help, that we're doing everything we can for you. So don't be afraid to say, hey, let's get some more information here, especially if it goes on for a long time. And we're going to end it here. And so thank you so much. I really want to thank you for your time, attention, and engagement.